If you're fighting allergies today, you're not alone. 1 in 5 Americans suffers from allergies, including allergies to triggers such as pollen, mold, dust mites, or animal dander. Your reactions to these are most likely inherited from your parents, so there's often nothing you can do to prevent them from starting. Once your allergies begin, if left untreated, chances are that more and more allergies will continue to appear throughout your life. If you have allergies, you may also have undiagnosed asthma or could develop asthma. And to make matters worse, it's now clear that allergies are on the rise. Fortunately, millions of people are winning the fight against their allergies, thanks to healthcare providers who are trained in allergy immunotherapy. These specialists provide medical advice and treatment to evaluate and manage allergic diseases. The results of allergy immunotherapy provide a welcome relief and, for many, improved long-term protection compared to antihistamines or other drugs commonly prescribed for allergies.
The first step for most people is to manage your allergies by avoiding the substance that causes allergic reaction, the allergen. Over-the-counter medications can also help control symptoms. But if your allergies are keeping you up at night or impacting on your productivity and day-to-day activities, your doctor may suggest immunotherapy, commonly referred to as allergy shots.
To receive the maximum benefits and safe treatment with immunotherapy, it's best provided by highly trained specialists in allergy and asthma. The family and health histories they request on your first visit, which usually lasts a few hours, help them evaluate the types of allergies you may have. Do allergies run in your family? What do you think you're allergic to and why? Do you get a rash or sinus congestion? Do your symptoms last all year or are they seasonal? This information combined with your physical exam are the first steps to precisely identifying the exact substances that cause your allergic reactions. The second step, the skin test, is a vital part of the process to diagnose the specific allergens that cause your reaction. This simple test assists the physician in determining what you're allergic to and sets the path for the specific steps that will be used for your immunotherapy. A small volume of each allergen is applied to your skin with a device that barely pricks the surface. If you are allergic to one or more of the allergens, you will display some redness and swelling at those test spots.
Most people tell me that there is only a little discomfort or a little itching. It only takes about 20 minutes to see the results. If a result is unclear though, your physician may need to repeat the skin test or conduct a different confirmatory test.
Once your skin testing has been completed, you'll discuss your results and treatment options with your doctor.
Most people we test for allergies haven't been able to control their environment and avoid the allergens that they're allergic to. They're looking for relief. They've also tried over-the-counter medications and maybe even prescription medications that are designed to treat their symptoms.
Medications can partially or largely provide temporary relief of allergy symptoms, but don't address or alter the causes of allergy. These medications need to be taken continuously and often every day. Once the medication wears off, the symptoms return. On the other hand, allergy immunotherapy can change the allergic disease process. This allows immunotherapy to provide relief of symptoms both during treatment and for many years after treatment is stopped.
With immunotherapy, we gradually desensitize you to the allergens that you're allergic to. Imagine it takes this much pollen to make your eyes itch and water, your nose run, make your throat itch or swell. Initially, we're going to give you a very small amount of the allergen that you're allergic to, and then gradually increase that amount at weekly intervals. This is called the build-up phase. As we increase the amount of allergen you're receiving, you should begin to react less strongly to the allergens in your environment. Eventually, this should make you almost symptom-free.
Immunotherapy is effective for most people and often prevents other allergies from developing. Parents are always glad to know that many studies have shown immunotherapy may be effective in treating asthma. Your pediatrician will recommend the appropriate age to introduce your child to immunotherapy.
Most patients like the idea of a long-lasting solution for their allergies. For many, medications, tissues, sprays, and fear of bee stings becomes a thing of the past. But there are no guarantees, and nothing this powerful comes easily. Immunotherapy requires a strong commitment on the part of the patients.
Immunotherapy involves a series of injections with a mixture of allergens that are custom-made for each individual's body. These allergen mixtures are most often formulated at your physician's office. The allergen solutions or extracts used to make up your immunotherapy treatment are created in specialized laboratories. One of them is Greer Laboratories, located in Lenore, North Carolina.
Greer Laboratories has been a trusted provider of allergen source materials for over 100 years and of allergen extracts for immunotherapy for over 50 years. Greer services over 7,000 customers worldwide and offers over 400 allergy products. We collect and process pollens, danders, insects, and foods from all over the world and grow others like molds and dust mites on site at Greer. These materials go through a complex process before being sent to your physician for your specific treatment. Basically, we make an extract. Think of how you'd prepare a cup of tea from tea leaves. You're extracting the soluble tea from the leaves in much the same way that we would prepare extracts of pollens, dust mites, and other allergens.
Your prescription or treatment is a unique recipe of these extracts, and that doesn't happen overnight. The extracts are mixed at very specific concentration, custom made just for you. If you're allergic to several things, multiple allergen solutions may be balanced in your treatment. You may also receive several dosages per visit if you're allergic to a number of items. Depending on your specific allergies and situation, your allergist may recommend a variety of treatment options.
There are two phases to immunotherapy. In the build-up phase, which we mentioned earlier, you'll come to your doctor 1 or 2 times per week for 3 to 6 months to receive the injections that will make you less sensitive to your allergies. In the maintenance phase, your visits are much less frequent, as little as once a month, and you receive the highest allergen dose determined to be effective and safe for you by your physician. The injections only take a moment, but after your injection, you'll wait for about 30 minutes to be sure that you won't have an adverse reaction.
We see very few adverse reactions in our practice during immunotherapy. Although the doses are carefully controlled, occasionally a reaction can occur and it may be serious. The medical term for an allergic emergency is anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that has a sudden onset and may affect many parts of the body all at once. It's best to be close by because our quick treatment is critical to your safety. We treat severe allergic reactions with a shot of epinephrine. Other treatments may also be needed, depending on the symptoms. Rest assured, we'll teach you how to recognize an allergic reaction, and we have everything we need on hand to keep you safe.
We take the safety of our patients very seriously, so that's why we are required to have them wait in the office for about 30 minutes after their treatment. Most people realize that this is just a minor inconvenience to ensure their safety.
I feel so much better, and this is the height of my allergy season. I haven't missed an appointment, and I'm almost to my maintenance phase. This is the best thing I've ever done for my allergy.
For most people, immunotherapy involves an initial commitment of time. It's important not to miss an injection. If you do miss a visit, you'll begin to lose some of the benefits that you've worked so hard to achieve. You may even have to repeat previous doses to regain your progress and ensure your safety. The rules are still the same in the maintenance phase. It is recommended that you do not miss a dose, but most patients feel so much better in this phase that a monthly visit seems like a small price to pay.
When they comply with their treatment schedule, many of our patients report that they're much less sensitive. Immunotherapy has actually changed their body, so they react less strongly to the allergens that once made them so miserable. Depending on their allergies and their situation, we may recommend that some patients return for occasional visits to maintain their protection.
In the long run, I believe I actually ended up saving money when I compare it to all the over-the-counter medications that I had to take every single day. It was a commitment, but immunotherapy changed my life.
Immunotherapy isn't for everyone. Sometimes, even though the history is very consistent with allergy, the skin tests show that you're not an ideal candidate. Some people don't respond well to the injections, and others have medical conditions that aren't compatible with immunotherapy. Others simply can't make the commitment. We understand. For some people, prescription drugs work just fine. If you have allergies and you just want relief somehow, some way, there's good news. You have options.
Thanks to some very highly trained and dedicated healthcare professionals, there is life after allergy. We hope you find it, one way or the other. Brought to you by Greer, in partnership with Allergy Partners. Immunotherapy is indicated when careful testing and patient history can pinpoint allergens responsible for allergic symptoms, and when it is not possible or practical to avoid these allergens. Immunotherapy is contraindicated in those individuals who do not exhibit skin test or clinical sensitivity to antigens. Allergy injections should be administered only by someone who has been specifically trained in how to handle local and systemic reactions. Patients receiving allergenic extracts should be kept under observation a minimum of 30 minutes so that any adverse reaction can be observed and managed properly.